Marijuana and Pharmacy, presented by Anne Fan and Destiny Mischler. Throughout the United States, marijuana usage has recently been more widely accepted for recreational uses and for medical reasons. Since marijuana was recently illegal, many people are unaware of what the new laws are concerning marijuana and, more importantly, where marijuana legalization fits into pharmacy as a profession. In this presentation, we're going to obtain a better knowledge about recreational marijuana usage, its medical use, the laws concerning marijuana usage, and how this could potentially affect pharmacy as a career. Let's talk about some of the advantages and disadvantages of legalized recreational use. Legalizing the recreational use of marijuana can help in improving the state of economy in the United States. Marijuana is the only known drug to have the mechanisms of action that it has. The drug will also contribute immensely to the recreational drugs market in the country by contributing to the profits that the country generates from the sale of other drugs, such as alcohol and cigarettes. Another positive aspect that has been considered with legalization of marijuana use is the decrease in expenditures on law enforcement and a decrease in prison population. It is estimated that $10 billion is spent every year on enforcing marijuana prohibition, which is money taxpayers could be saving through recreational use legalization. Another important positive aspect of legalized recreational marijuana is that organized crime would lose a way to make money. Currently, marijuana is widely used in the illegal drug trade as a way for organized crime to make money. One major issue of recreational marijuana use is that it impairs your mind. Much like alcohol, an individual should not drive a car or operate machinery when they are high. A study that was done showed that marijuana was the most common illegal drug found in drivers who were impaired or fatally injured in a car accident. Another aspect of legalization of marijuana, aside from just recreational uses, is the medical usage, which is currently legal in 23 states and Washington, D.C. This is different from recreational usage in that to be able to use marijuana legally, an individual needs a prescription from a doctor and a medical problem that marijuana could be used to help. Marijuana has been shown to have positive uses other than just pure recreational uses. For example, marijuana has been shown to reduce nausea and vomiting, especially in individuals who are going through chemotherapy. It has also been shown to relieve muscle spasm experienced by individuals with multiple sclerosis and paralysis. Marijuana also increases appetite, which can be helpful with patients who have HIV, AIDS, or cancer in preventing weight loss. In addition, it can relieve certain types of pain and is thought to be safer than prescription pain medications. Now let's talk about some of the laws concerning the usage of medical marijuana. California was the first state to make medical marijuana legal in 1996. The laws regarding medical marijuana are that to be eligible for it, an individual must have a physician certify that they are in a health situation or health condition that would benefit from marijuana use, such as AIDS, cancer, multiple sclerosis, severe pain, or severe nausea. A physician must also prescribe the patient marijuana, and then the patient can obtain the state issued identification card after the state has received the patient's application, physician certification, and the fee. These cards usually have to be renewed every year. Most states do not require insurance to cover the cost of marijuana. 15 of the 23 states allow patients to grow their own plants. However, in Arizona, an individual must live greater than 25 miles away from a dispensary to be able to grow medical marijuana. In Nevada, individuals are only allowed to grow and cannot buy from dispensaries. In Massachusetts, an individual can grow if they cannot afford to buy from a dispensary. In the states that allow home growing, the patient can designate a caregiver to grow for them if they are too weak to do so for themselves. Next, we're going to talk about the role a pharmacist plays in marijuana. Pharmacists have the role of ensuring that the rules of regulations set are observed in the dispensaries so as not to place the dispensaries at confliction with the state or the federal law. In general, marijuana has a lot of variability, so proper dosing of its medical formulation for patients is an imprecise measure. In some states, pharmacists are given the duty of determining dosing for patients over physicians. Normally, the physicians make the decision on what dosage is appropriate for a patient, so this new model where the patient and the pharmacist determine a dosage is very new. Dispensing pharmacists handling medical marijuana have the role of monitoring outcome of patients taking this medication and transferring that data to determine safety and efficacy of the product. Pharmacists are not only tapping their knowledge into the supervision of dosing, they're also tapping into an area with limited research to guide them. The future of medical marijuana dispensaries relies heavily on the status of laws and regulations at both the state and the federal level. Marijuana has too much potential variation, making the struggle of perfecting its safety and efficacy of use an ongoing process. There is still a lot of research that needs to be done to completely understand and benefit from the usage of medical marijuana. The potential of medical marijuana, when used appropriately, outweighs the risks. Moreover, the use of the drug medically has proved helpful in various situations, especially in the treatment of terminal disease such as cancer and HIV and AIDS. As long as it is regulated, there's more benefit of bringing medical marijuana to helping with treatment than harm. The promising uses of marijuana may set a bright future for pharmacy as a career because more and more uses of the drug may be discovered with continued research and studies on the drug. In addition, it may also turn out to be useful in the treatment of other diseases apart from just depression, stress, and pain. Pharmacists may have the chance to expand their knowledge to the study of the drug and use it in various situations in their career.